Greetings to all viewers. I'm Dr. Shobana Mohandas. I work as a gynecologist and laparoscopic surgeon at Sun Medical Center, Thrissur, Kerala. I wanted to talk about a very common condition among women today. That is, almost 50% of women, every other woman has got this problem that when she coughs or sneezes, she has involuntary passage of urine and she cannot control it. This is because the angulation of the urethra is lost and there is sagging of the urethra. So there should be a scaffold near this sagging area. That is the way this problem can be controlled. So there is a simple way of doing it, and that's called a new method, that is platelet-rich plasma injection. We have in our blood 2-3 types of cells. The white blood cells, they fight diseases. Red blood cells carry oxygen and nutrients. And we also have platelets. These are very tiny things, but these platelets can promote the growth factors, and the cells will grow under the stimulation of platelet-rich plasma. It's a very simple procedure. The patient's blood is removed. It is just centrifuged, takes just 10 or 15 minutes time, and the platelet-rich plasma is extracted and injected under the urethra. That is where the sagging tissue is there. So it is injected under the urethra. The tissue there grows and creates a scaffold, and there is relief for this symptom. A patient may need 2 or 3 sittings at 3 to 4 weeks interval. It's a recent thing, so we do not have 10-year follow-up or anything, but even then, it's a so simple procedure which doesn't require anesthesia and just not painful. It doesn't require rest. So compared to the other modalities which were there so far, this scores over them. It can be repeated even if it recurs. I do not think it should be a problem. So let's go through the other modalities that were there for this problem before. Number 1, when you have this problem, you could have pelvic exercises like Kegel's exercises, where you tighten the pelvic muscles and hold your breath and release them. And so once the pelvic muscles are tightened, the stress incontinence decreases. Second, medical treatment was there that makes a person, that area dry and eyes dry, mouth dry. So side effects were there, and it used to not last very long. Temporary measures like putting a vaginal tampon or menstrual cup inside was also useful, but that's only while traveling or something. It cannot be kept as a permanent method. Permanent methods were putting a tape under the urethra surgically, just a 1-day procedure under anesthesia, and the patient could go home in 1 day's time. But the cost was somewhere between 35,000 to 1 lakh or even above, depending on the tape used and the hospital where it is done. But it required anesthesia, and people do not like to spend that much of time in a hospital or even spend that much of money. So compared to that, platelet-rich plasma is a much simpler procedure, the injection of that. And then there is a laser treatment which is very simple, but then again it's costly. So compared to all the modalities, platelet-rich plasma injection is a very simple, effective and useful procedure for the treatment of stress incontinence, and should be kept in mind for all women who are suffering from this problem which causes embarrassment in their life. I hope this video is useful for you. Thank you so much.